The next question is for Dr. Anand. Was there a body of evidence-based programs that communities could specifically choose from when participating as a Healthy Weight Collaborative team?
So there was a body of evidence related to the evidence-based programs and the published literature. And then we drew from the experience of our faculty and all of the wonderful things we had heard about successful programs on the ground, because as many of us know, only a small set of what's actually being done out there makes it into literature fast enough to be useful for a program like this. So we drew upon all of our knowledge. So I don't think there's kind of a registry of the programs that exist. There are some standouts that are available on the website as well. And I think that there is a larger body of experience now that the collaborative has closed, and we can point to the examples that were used within the collaborative.
Great, that's wonderful. Could you, since you referenced your website, could you please provide the website address?
Sure. Do you want me to chat it in?
If you could just share right now through audio.
Absolutely. So it's www.collaborateforhealthyweight.org.
Thank you very much. Our next question is for Dr. Linda. The question is, what have you learned about linking the primary care, community, and public health settings from the overall Healthy Weight Collaborative effort?
Well, I think what we've learned is how important that link is if you want to improve the health of not only individuals but of communities and ultimately the nation. There's a lot of discussion in the public health world and in the healthcare delivery world about transforming the health system in our country. And I think the Affordable Care Act in particular has provided us an opportunity to really integrate these 2 or 3 areas, primary care, public health, and the community. And so there's a lot of effort. The Healthy Weight Collaborative is one example of how this can be done, again, with the focus on obesity, but with outreach and enrollment as new people are going to be eligible for health insurance, more than ever, that's going to place a huge demand on the health care delivery system, which again will sort of drive further efficiencies. There's primary care and public health both focus on prevention. We know that most non-communicable diseases that are the source of healthcare costs are preventable diseases, and so if we work better together among primary care, public health, and the community, hopefully we can change some of those environments and circumstances in which people live and work and play and achieve better health, not only in the area of obesity but also in the other major chronic diseases.
Great. Thank you so much, Dr. Linda. The next question is actually for Kari. Do your worksite changes and recognition program include breastfeeding support, facilities, and or policies?
Yes, it does. And actually, we're working with our local Healthy Start Coalition for that. They already had a recognition program to honor those work sites that were taking on those types of policies. So what we're doing is sort of blending that recognition in with ours and doing some, I guess, extra promotion for them and kind of handing it off to the Healthy Start Coalition when a business identifies that as a policy target that they want to work on. So, like we're trying to align some of these things to national initiatives that are going on, we're also trying, especially with that worksite initiative, to link our efforts with some of the local initiatives that are happening as well, so that we can be efficient and really do this in an effective way where all of our community partners can benefit from this.
Great. We actually have so many questions coming in for the Healthy Weight Collaborative teams. We have another question for Shayla. In San Diego, was the decrease in BMI seen among minority populations as well?
Oh, that's a great question. Actually, almost 80% of our population is minority. If you can, I didn't get a chance to really explain in detail the map, but there is sort of an east-west divide in our district, and so on the map, the higher BMI rates of the schools on the left-hand side of the map were really concentrated on what we call this fast food corridor and a really unhealthy environment with limited open space and older homes and more safety issues with parks being overtaken by homeless or gang activity. So a lot of that environment on the left side of the map had to do with lower socioeconomic and environmental conditions that led to higher rates of obesity in those schools, which also housed a predominantly lower socioeconomic and minority population. So the dropping rates that we noticed were actually indeed in many of those schools.
Great. That's actually very helpful to know, and especially because healthy people, one of its overarching goals is the elimination of health disparities. Kari and Shayla, we have yet another question for you. Do you have particular private partners who are playing a very key role in your activities?
Kari, go ahead.
Private partner. I would say that we have a number of businesses at this point that are really interested in what we're doing, and of course a lot of organizational partnerships from the Extension Office to various nonprofits to just a wide range of faith-based partners as well. I wouldn't say that any private partner is particularly driving the process. They're just sort of going along with us at this point. But we do see opportunities to sort of build those private partnerships in the future, especially with regard to our worksite initiative. But that hasn't been fully explored or implemented just yet.
And this is Shayla in San Diego. Private partnership, yes, we have one very large organization, the COI, which is a County Obesity Initiative, which is both private and public. So it has a public health department, but also has CHIP, which is a private partnership, and it's really allowed a lot of our work in the initial target population to reach more broadly countywide. And I'm not sure what other categories of private you're thinking about through that question in terms of like physicians in private practice. We have engaged some of those, although predominantly we're working with community clinics and larger healthcare organizations. And other private that comes to mind would be the local liquor stores that were engaged in a project to bring more fruits and vegetables into these sort of desert areas that didn't have access to fruits and vegetables, and so some of the liquor stores were partnered through the County Obesity Initiative and some public-private partnerships to create a farm to store project to stock more fruits and vegetables there. So over time, there's also some recreational programs that are private that have collaborated with us to provide increased physical activities through the school sites and after-school programs. So I would say sparsely there are intermittent sort of private partnerships, but predominantly, as Carrie mentioned, we are more public and dominated collaboration with county support.
Thank you so much, Shayla and Kari. Thank you also to Laura Kettle-Khan and Dr. Linda, and also to Dr. Anand for participating in today's webinar.